We're standing here at the 4th Annual Day of Action here in Toronto. We are one of 20 cities that has organized healthcare workers across this country to ask for the federal government to rescind their cuts to refugee health insurance.
The doctors have documented dozens of cases of pregnant women and sick children who are refugee claimants being denied care.
The cuts to the interim federal health program puts our healthcare professions in an untenable position, forcing them to choose who receive treatment based on a complex set of rules.
Since 2012, paperwork gymnastics, multiple phone calls on a daily basis are part of our routine. The rules are barely understood by the people in the system.
The Federal Court of Canada in July 2014 found these cuts unconstitutional, in violation of the Charter of Rights and Freedoms, and described the cuts as, quote, cruel and unusual treatment.
First of all, the government says this is about saving costs. It's not about saving costs. In fact, the best way to ensure that costs rise is by depriving people of the most basic and efficient forms of health care. And when you deprive them of that, they end up where I work in the emergency room with complications that are cruel and are incredibly costly. So this is nothing about cost savings.
The federal government within hours announced it was appealing the Federal Court of Canada decision, brought in a temporary coverage program which did not fully comply with the judge's order. The federal government spent over $1 million, well over $1 million, in legal costs just opposing our actions.
And to be honest, the only conclusion that one can reach is that it's a completely ideological decision. The courts have struck this down. The people of Canada have made it clear that they don't believe that these cuts are appropriate or humane. And it doesn't make any sense that the federal government would be choosing to defend this decision rather than reverse it.
The fact remains that refugee claimants are in our country, and until the federal government determine their status, many refugee claimants, including sick children, pregnant women, will require care. We support a healthcare system that reflects the principles of fairness and compassion and providing health as a right for the people in this province.
We've asked for a meeting with the Minister of Citizenship and Immigration Canada, Chris Alexander, from a few days after he actually obtained the portfolio. We have yet to hear back.
And we know that the federal Conservative government is listening. Last year, the Conservative government monitored the 3rd National Day of Action sponsored by Canadian Doctors for Refugee Care, and our activities were reported to the government's Operations Centre, which is responsible, believe it or not, for threats to national public safety and security.
We've had support from over 20 national health associations in Canada, including the Canadian Medical Association, the Canadian Nurses Association, the Royal College of Physicians and Surgeons of Canada, the College of Family Physicians of Canada.
Unfortunately, this government has been incredibly intransigent, despite hearing the voices of the Canadian healthcare community, Canadian artists, of the courts now, provincial health ministers, all of whom have condemned the cuts. They still are unwavering.
We will not succumb to your conservative rhetoric that these cuts are about saving taxpayers' money. This is a rhetoric, and this is a pernicious and vicious attack against justice-seeking people and refugees in this country.
Listen to healthcare providers, listen to the doctors and the nurses and the social workers and the Canadian citizens, and listen to the federal court who is telling you that this is not a humane way to treat human beings, and this is not something that allows us to be proud of being Canadians.
We will come back, and we will continue coming back to this corner, and as I said, many corners in this city and across this country, to declare that the government's position by cutting health care to refugees and for refugees is a bogus act.